How often does transverse myelitis progress to MIS? Have you ever wondered how often transverse myelitis leads to multiple sclerosis? This is a crucial question for many who have experienced transverse myelitis. Transverse myelitis, or TM, is an inflammatory condition that affects the spinal cord. It can cause a variety of neurological symptoms, including weakness, sensory changes, and bladder dysfunction. While TM can happen as a one-time event, it can also be an early sign of multiple sclerosis, which is a chronic autoimmune disease affecting the central nervous system. Research shows that approximately 10 to 13% of cases of idiopathic acute transverse myelitis progress to multiple sclerosis. Idiopathic means that the cause of the transverse myelitis is unknown, and it is not linked to other conditions like neuromyelitis optica. Studies have followed patients diagnosed with idiopathic acute transverse myelitis and found that about 13% convert to multiple sclerosis over an average follow-up period of around 3 years. Interestingly, younger age at the onset of transverse myelitis symptoms is associated with a higher risk of progression to multiple sclerosis. This means that if someone experiences TM at a younger age, they may need closer monitoring for potential development of MIS. There are additional factors that can influence the outcomes in transverse myelitis. For instance, the presence of urinary sphincter dysfunction at the onset of TM and the finding of longitudinally extensive transverse myelitis on magnetic resonance imaging can indicate a poorer functional recovery. However, these factors do not necessarily predict whether someone will progress to multiple sclerosis. It is essential to understand that not all cases of transverse myelitis lead to multiple sclerosis. Many patients experience a monophasic illness, meaning they have a single episode without further demyelinating events. Some individuals may even have recurrent episodes of transverse myelitis without ever developing multiple sclerosis. These cases often have different clinical features and responses to treatment. From the perspective of multiple sclerosis, knowing the risk of transverse myelitis progressing to MIS is important. It helps in early diagnosis and management, allowing for timely initiation of disease-modifying therapies when appropriate. However, every case is unique and requires careful evaluation by healthcare professionals. This includes clinical assessments, MRI findings, and laboratory tests like cerebrospinal fluid analysis and antibody testing to guide prognosis and treatment decisions. In summary, while about 10 to 13% of idiopathic transverse myelitis cases progress to multiple sclerosis, most cases do not evolve into MIS. Careful monitoring and follow-up are crucial to detect and manage any potential progression. Always consult with healthcare professionals for personalized advice and management.